Okay, hello everybody and welcome to this webinar by the European Disability Forum with the support of the European Anti-Poverty Network. I hope that everybody is well and I want to thank you very much for attending this webinar with us today. Today we will be talking about the issue of poverty and social exclusion of persons with disabilities. Now, before I introduce our speakers for today, I would just like to share with you some logistical information and some housekeeping rules on how this webinar will work. So you can find the link to access real-time captioning in the chat box. So the chat box should be located on the right of your screen. There's a link at the top. The other links you will find in the chat box are the links to our new EDF publication on poverty and social exclusion. We have one link which is for an accessible PDF format, and another one which is for a Word format in easy to read language. As some of you will have noticed, the webinar will also have international sign language interpretation. All of you as participants have muted microphones and EDF controls the permission to unmute this. So don't worry if you're trying to unmute yourself and you're unable to, this is entirely normal. In case you face any technical issues, you can ask my colleague Raquel through the chat box. So just type a question to her and she will do her best to respond. We would also like to invite you to ask any questions using the question box. So this is below the chat box, and you can ask your questions to the speakers at any time. We will do our very best to leave time at the end of the webinar to ask these to the panelists. And if not, we will do our very best to respond to the questions by email later on. Please indicate if you submit a question to which speaker you would like to ask your question. Okay, so my name is Haydn Hammersley. I will be your moderator today. I'm the Social Policy Officer at the European Disability Forum. I'm also going to be a speaker, so I'll give you a brief introductory presentation on the subject for today, which is poverty and social exclusion of persons with disabilities. I'm going to be showing a short PowerPoint presentation for my own presentation. There will be some maps and some graphs included, which I will describe briefly to show the main information. But the full document, well, the full PowerPoint presentation is available in a tab called Handouts, and this includes alt text to fully describe all of the information. So there you can find information specifically on your country. And of course, you can find all of this information in the publication by EDF itself, which I would really warmly invite you to open and to read. Okay, during the webinar, we will have 4 guest speakers. So we're very fortunate to have with us Elena Schubert from the European Commission's Directorate-General for Employment, Social Affairs and Inclusion. Ms. Schubert will talk about some of the ways in which the EU can have an impact on this topic, and also will address some of the particular challenges posed by the COVID-19 pandemic. We'll then be joined by Vera Hinterdorfer, who's the Vice President of the European Anti-Poverty Network. She will talk a little bit about how the EU addresses poverty in more general terms. Then we will be joined by Steenbroeke. He is the Senior Economist in the Employment, Labour and Social Affairs Directorate of the Organisation for Economic Cooperation and Development. He's going to be talking to us about the prospects of future employment for persons with disabilities. And then we have a final speaker who, if any of you are familiar with EDF, you will know her already. Her name is Loredana Dixie. She works for EDF, and she will be giving us a personal testimony on how this subject matter has affected her personally. Now, just before I begin with my presentation, I want to start by thanking our interpreters, Ferdinand and Lisa. as well as our live captioner. And of course, I want to thank our speakers for taking the time to be here, and also to all of you for joining. Okay, so I'm going to now share my screen with you. And normally you can now all see my presentation. Okay.
Yes, we can see that perfectly, Haydn. Thank you.
Perfect. Okay, so again, you'll just see briefly our program for today, as I just outlined. And now I will begin just by giving an overview of the topic of poverty and social exclusion for persons with disabilities. So as mentioned briefly, all of these findings come from a report that was released on Monday by EDF. As you can imagine, the title of the report is Poverty and Social Exclusion of Persons with Disabilities. And you can find in the chat box, but also on our website, the accessible PDF document and an easy to read version. So let's talk about the main things. Here we are dealing mostly with comparative EU level data from Eurostat. And the main thing to begin with is the fact that persons with disabilities are far more at risk of poverty and social exclusion than persons without disabilities. So the risk of poverty for persons with disabilities in the EU is around 28.7%, which is almost 10 percentage points more than for persons without disabilities. Now on this slide, I'm showing the first of our maps. It's a map of the EU, and for the sake of this study as well, we include the United Kingdom. It shows the countries with different colors according to the level of poverty in each of those countries, with the countries in red being those with the highest risk of poverty. We see in particular a risk in the Baltic states, in Estonia, Latvia, Lithuania, in the Balkans as well, in Croatia, very high rate of poverty, in Romania as well. The highest within the EU is in Bulgaria, where almost 50% of all persons with disabilities are at risk of poverty and social exclusion. And then in the west of Europe, Ireland also has a very high risk of poverty and social exclusion. Now on this slide, another thing that's really interesting to look at isn't just the rate of poverty among persons with disabilities, but also how much more at risk of poverty persons with disabilities are compared to persons without disabilities. So we have a similar visual here where we have a map, and the countries in red are those where we see the biggest difference, where persons with disabilities are far more likely to be poor than persons without disabilities. So again, in Western Europe, we see very high differences in Ireland, in the United Kingdom, in Belgium, and in Germany. Again, the Baltic states see very high differences in poverty rates between persons with and without disabilities. And then again, in the Balkans, in Croatia and in Bulgaria, we see very big differences. Interestingly, in some countries where we see very high rates of poverty among persons with disabilities, the difference between the risk for persons with and without disabilities isn't that big. For example, in Italy and in Greece, the difference is relatively small. Now, what we've also found is that if you're a woman with a disability, you face a far higher risk of facing poverty and social exclusion. The risk for women climbs even higher than the figure we showed before, to 29.5% of all women with disabilities being at risk of poverty in the EU. This is the case. It's the case that women are more at risk in 22 of the 27 member states, and also in the UK. Another thing we did was to look at the increase in poverty levels over the past decade. And we found that in 11 of the member states, the rate of poverty among persons with disabilities actually increased since 2010. The biggest increase was in Estonia, where we saw an increase of 13.2 percentage points. But what's interesting is that actually some of the countries with the biggest increase weren't necessarily those that were affected a lot by the financial crisis that started in 2008. So for example, the second biggest increase was in Luxembourg, the third biggest increase was in Germany, and the fourth biggest increase was in Sweden. So all countries that came out of the financial crisis not unscathed, but without as much impact as in other member states. We also looked at employment rates. So these EU level figures show that just over 50% of persons with disabilities are in employment, compared to 74.8% for persons without disabilities. If you're a woman with a disability, the likelihood of being in employment is lower. So the figures show that 48.3% of women with disabilities in the EU are in employment. And then when looking at these figures, it's really important to underline that they don't show the quality of employment behind these figures. So we know that many persons with disabilities have precarious work contracts. They get paid at minimum wage, sometimes below minimum wage. It doesn't show how many of these people are in employment in the open labor market and how many are in sheltered employment. And of course, a really crucial thing is that these figures don't take into account persons with disabilities living in institutional care, of which we estimate over 1 million people. And most of these persons living in institutions are unlikely to be employed. So again, here we have a map showing the countries in the EU with the lowest employment rates of persons with disabilities. The lowest being Ireland, with an employment rate of 32.3%. We also see very low employment rates in Croatia, in Greece, in Spain, in Malta, in Belgium, and in Poland, as well as Romania and Bulgaria. But when we again look at the difference in employment rates between persons with and without disabilities, we see that some countries, even relatively rich countries, where employment levels are generally not so bad, we see a big difference between the employment levels for persons with and without disabilities. So again, we see a very big employment gap in Ireland, where persons with disabilities are 42.1 percentage points less likely to be employed than persons without disabilities. We see a big difference in the United Kingdom, in Belgium, in Sweden, in Lithuania, in Poland, in the Czech Republic, and in Bulgaria. Now, a really essential thing to look at when talking about poverty and social exclusion of persons with disabilities is the extra cost of living when you have a disability. This is something we looked at in this report. We didn't conduct the research ourselves, but it has been conducted by several universities in the EU. And they have findings of estimated average additional cost of living per person with a disability per year, based on the ability just to make ends meet. And we see, for example, that in Sweden, they estimate an additional annual cost of 23,000 euros per person with a disability. In the Netherlands, this additional cost is just under 21,000 euros. And in Denmark, it's about 20,500 euros extra per year. So quite considerable costs. And again, it's not only if you're a person with a disability that you're likely to face these additional costs, but also for households with persons with disabilities. So a study from the UK showed that the poverty rate for households with children and where at least one member of the household has a disability is 43%. So nearing half of all households with children and with somebody with a disability living in poverty. And when it comes to employment rates, in 27% of households where somebody has a disability, none of the adults of working age would have a job. So that's also quite a shocking statistic. And then for my final slide, we looked at the question of homelessness. So again, we don't have figures at the EU level, but we do have studies from several member states and also from the UK. For example, a study from the Netherlands showed that 29.5% of homeless people in the Netherlands had an intellectual disability, whereas the average prevalence at a national level should be something around 0.7%. So we see that persons with disabilities are really overrepresented among among homeless people. In the UK, a study showed that 12.3% of homeless people showed autistic traits in line with diagnosis, whereas the average prevalence is believed to be around 1%. And another British study showed that 80% of homeless people reported having mental health issues, and 45% had actually been diagnosed. Okay, so that is it from my presentation for now. I would just finish by encouraging you to read the publication. We have much more information. It's a very thorough study. It looks also at disability assessment, different employment policies in the different member states, what type of disability creates the most barriers to employment, the impact of ethnicity and the place of residence, and so on. So I'd like to thank you very much. I will stop sharing my screen now. Okay, perfect. And I will now hand over to our first speaker for her intervention. And this speaker is Elena Schubert from the European Commission. So Elena, I will hand over to you.
Hello, good morning. Can you hear me?
Yes.
Can you hear me well?
Yes, we can hear you perfectly, Elena. Thank you.
Yes, I'm very honored to be there today and listen to you. It is quite difficult times in the world and in the European Union, because we have to face major pandemic that I haven't experienced in my life. I would like to start with what our Commissioner Dalli, the Commissioner for Equality, the first Commissioner for Equality ever, because the von der Leyen's Commission is the first Commission that has created a portfolio of equality and non-discrimination. And our Commissioner Dalli has said, with a view of the current situation, that the European Union is fully determined to fulfill its commitments, also under the current circumstances. He highlighted that we must ensure that fundamental EU values of equality and non-discrimination are as strong as ever in the current circumstances. So what she meant is that we cannot deviate or leave our commitments that we have for the implementation of the UNCRPD, even in those difficult times. Together with Commissioner Schmidt, she urged member states to ensure that vulnerable groups, including persons with disabilities, receive the needed support during COVID-19 crisis. Further, Commissioner Dalli sent a letter to ministers in charge of persons with disabilities in member states, where she underlined that attention should be paid to the accessibility of information on personal care and other services. She highlighted that public announcements on COVID-19 should be made accessible for persons with disabilities, and no one requiring healthcare attention should be deprioritized because of her or his disability. I think this is very, very important, that we, at the time of crisis, we really think of the most vulnerable in our societies. Haydn has referred to the issue of the important gaps that persons with and without disabilities. As you know, we in Commission, with employment, the focal point for the implementation of the Convention, has been funding a network of experts for disability, academic network for experts with disability, ANET, and they have, together with Eurostat, elaborated on the statistics that Haydn has been referring to. So this is very, very important that we monitor the situation, and now with the crisis even more closely. Let me refer to the major tools that we are now going to continue to work on even more intensively with a view of the consequences of COVID-19. And let me start with the European Pillar of Social Rights. This is the overarching agenda of von der Leyen's Commission to cover all important social issues. You might be aware that on 14 January 2020, the Commission published a communication on a strong social Europe for just transitions. And this is a sort of the Commission von der Leyen's roadmap, how to implement the European Pillar of Social Rights. This communication very much refers to persons with disabilities. It puts forward the central role that is given to equality and non-discrimination. I would like to point out that Commissioner Dalli established equality task force within the Commission that includes commission staff, commissioner officials that are being appointed in all DGs to mainstream disability issues, to mainstream equality agenda and non-discrimination agenda. This is very, very important so that every initiative, every law, every piece of legislation is going to be also reflect the issues of equality issues and non-discrimination, and certainly also the principles of the UNRPD. Let me quote from the communication, because I think this is something that we will be always referring to in these difficult times that also come after the immediate crisis. And that the communication is very clear about that. And this is the quotation from the communication: an economy that works for people is an economy that works also for people with disabilities. I think this is very, very important. Communication refers to the fact that people with disabilities continue to face difficulties in accessing education, training, employment, social protection, and healthcare. And they often struggle to take active part in the political and cultural life of the communities. The communication also announces that the Commission will present a strengthened strategy for disability in 2021, and that will build on the results of the ongoing evaluation of the European Disability Strategy 2010-2020. So we are currently in the process of evaluating the current strategy. So we are going to identify what was okay, what went less well, and where we need to put focus on the next future strategy. And I think the current crisis also teaches us the lessons that we need to elaborate on in the future strategy. I would also like to refer to European semester. Haydn has already referred to the main indicators that the semester is monitoring, that have been elaborated in cooperation with member states and Eurostat, and that we have been working on with ANET together. Just to say that the European semester is the main vehicle for the implementation of the European Pillar of Social Rights. And this year, this semester is very special because it also integrated the United Nations Sustainable Development Goals to ensure the sustainability and well-being next to the economic issues that are being monitored in the semester. I don't know if you have seen into detail the results of winter European semester package that had been published at the end of February 2020. We have been studying the country reports very carefully, and I can tell you that the references to persons with disabilities are basically across all country reports. And as Haydn has said, the major gaps unfortunately still persist. The highest is in employment, almost 25 percentage points, and of course we have roughly 10 percentage point gaps in education and in the poverty and social exclusion. And I fear this might even become bigger now as the consequence of crisis. So we need to work hard towards closing those gaps. the Commission has already now, with the crisis, has undertaken major steps to mitigate the crisis and the consequences of the crisis. I don't want to take too much time to name all of them, but just let me refer to some of them. First of all, the web page containing the response to COVID has been made accessible for persons with disabilities. Furthermore, regular video messages of the President of the European Commission, von der Leyen, about the common European response to the coronavirus outbreak are now available in international sign language. The European Commission has prepared and proposed a first coronavirus response investment initiative. And that is very, very important because it made available 37 billion euro quickly. This initiative includes two key elements. First of all, providing liquidity by letting member states keeping advance payments that they have in the framework of the European Structural and Investment Funds. That would have, and secondly, adding significant flexibility, allowing member states to rapidly reorient their funds towards COVID-19 related measures. This has been released quickly, immediately after the outbreak. And then we have Coronavirus Response Investment Initiative Plus. And this new package is basically complementing the first package by introducing extraordinary flexibility to allow that all non-utilized support from the European Structural and Investment Funds can be mobilized to the fullest. I don't want to refer to the technical flexibility clauses that are within this package. I would just like to name one of them, and that is 100% EU co-financing rate for cohesion policy programs for the accounting year 2021, allowing member states to benefit for full EU financing for crisis-related measures. This is, I think, really extraordinary. I have not seen that in the history of the EU would create so quickly with such vast flexibility measures. Let me also refer to the European Aid to the Most Deprived program, because there the Commission also made possible to deliver food aid and basic material assistance through electronic vouchers and to provide the protective equipment and thus lower the risk of contamination. And also it will be possible to finance measures under these programs at 100% rate for the accounting year 2021. So I think the Commission is really, we are now working around the clock to help, to facilitate, to support the most vulnerable in our societies, and that certainly also include persons with disabilities. And also we will be working hard that all the principles of the pillars will be upheld and will be supported by all the initiatives that will be coming and that we are working on very closely. So I hope I have not passed the limit of 8 minutes. If you have later some questions, I'm available to answer them. Thank you very much for your attention.
Thank you very much, Elena. This was a very full and very informative presentation. Indeed, the current pandemic has really changed the entire situation with regards to poverty and social exclusion, especially for persons with disabilities. So, of course, when reading the report, you have to bear in mind that these figures are likely to become worse this year and in the coming years. We will also, in the coming weeks, probably have a webinar on the subject of the use of EU funds to fight the pandemic and also the other effects of the pandemic. So this is something to keep an eye out for if you're interested in this. Okay, I would now like to hand over to our second guest speaker, that is Vera Hinterdorfer from the European Anti-Poverty Network. And Vera will be speaking a little bit about how the EU tackles the issue of poverty, excuse me, in more general terms. So Vera, I would like to hand over to you.
Hello to all, and I'm very happy that Haydn asked EAPN to join the webinar to talk about EU-level activities and policies to reduce poverty and social exclusion. also to give some perspectives for 2020 and beyond, and then to come to concrete proposals for advocacy work by disability organizations on the fight against poverty and social exclusion. My name is Vera Hinterdorfer. I live in Austria and I'm born with a rare neurological disease, so I need a wheelchair all the time. I worked as a social consultant until I was 30 years old, and then I retired because of my disability, which worsened. With my time as a pensioner, when it starts, it also started to be a person which lives in poverty. So here today I am as a vice president for the European Anti-Poverty Network, which is the largest independent network of NGOs committed to fight against poverty and social exclusion in Europe. This means 33 national networks and 13 European NGOs as members, together with people with direct experience of poverty, which are part of the solution and included in all levels and processes and meetings. The first thing you need to realize when you want to fight poverty is that poverty reflects a multi-dimensional reality. People experience poverty as many deprivations, and out of my own situation, I know this is the same for people with disabilities. It is not only about not enough money or not enough resources and the access to public and private services. It is also about the challenge to live a life in dignity without shame, stigma, or fear, without isolations and barriers everywhere. Poverty can prevent full personal and family development, as well as participation in social life. It's a denial of fundamental human rights, economic, social, and cultural. In 2018, the number of people at risk of poverty or social exclusion across the EU remains very high. 110 million people, or 21.9% of the total population. Particular high risks exist for specific groups such as children, non-EU born people, and unemployed persons. But for us today, I think it's most important the figure persons with a disability live with an aerobic rate of 29.3%, attaining 36.2% for those with a severe disability. So let's come to recent and current EU-level activities and policies to reduce poverty. Ms. Schubert already mentioned the European semester. It's delivering on goals and targets of Europe 2020 strategy, policy priorities of the European Pillar of Social Rights, and also the Sustainable Development Goals, like goal number 1 and poverty in all forms everywhere. The reformed European semester is also providing monitoring instruments like the social scoreboard. Second, I want to mention, not to go too deep because Ms. Schubert also said it before, the European Pillar of Social Rights. Important is to say that by end of the year, the action plan for the implementation of the social rights will be launched. And so we as AERPN are working to implement concrete initiatives for different principles. For the EDF, I think the target 17 is the most important one, which is inclusion of people with disabilities. Then we have the European cohesion policy and funds, including the European Social Fund and the European Social Fund Plus, with at least 25% dedicated to social inclusion and fighting poverty, and on top an additional 4% earmarking for social inclusion of the most deprived and material deprivation. Also there, for example, is the Fund for European Aid to the Most Deprived, known as FIAT. In the past years, concrete in 2015 and 18, the European Commission launched also the EMIN project, European Minimum Income Network. EIPN organized and coordinated these projects, and we made different reports and campaigns And we also drove through all countries of Europe with 2 different buses to catch the attention and raise the people's mind. Next, I also want to mention the European Commission recommendation about active inclusion from 2008. It's an integrated approach, which is still really important because it puts increased attention of policymakers on the interrelatedness of 3 mutually reinforcing strands: adequate income support, inclusive labor markets, and access to quality services. A full implementation of the recommendation in all EU member states would help addressing poverty and social exclusion, as it takes the perspective of the people in need, stresses their rights and dignity, supports people into quality jobs, and empowers them towards a full participation in society. And last but not least, in 2019, the European Economic and Social Committee adopted a second opinion for a European Framework Directive on Minimum Income. It held introducing a binding European framework for a decent minimum income in Europe, enabling adequate minimum income schemes, would be a significant European response to the serious and persistent problems of poverty in Europe. So let's come to the perspectives for 2020 and beyond. In 2020, the Europe 2020 strategy, with the headline target on reducing poverty by 20 million people, will come to an end, and it's a pity to say that it failed. A renewed EU anti-poverty strategy as part of Europe 2030 strategy are key demands of EAPN. We are not yet there, but we hear that there is an increasing political support to set up a new anti-poverty strategy in the context of the action plan of the EPSR. It's very sad that the target of poverty reduction was not included in the working plan of the current EU Commission, but so we hope that it will be an ambition, or there will come an ambition and comprehensive plan in the context of the EPSR action plan. It needs to have a special focus to reduce poverty and social exclusion. Such an overarching EU anti-poverty strategy would also frame the more thematic integrated strategies, such as on children and homeless persons, and it would support the implementation of the Council recommendations like access to social protection for workers and self-employed from last year, and on child guarantee, which should come in by the end of 2020. An EU anti-poverty strategy would also support the European Commission's guidance on energy poverty. We expect it also in 2020. Another perspective for us is the enforcement in EU member states of provisions promoting the involvement of CSOs in employment guidelines. For EAPN as a network of social NGOs, it is the key that civil society organizations and people experiencing poverty are fully involved in these processes, as this is also stipulated and somehow guaranteed in the employment guidelines, which give orientation as to the participation of civil society in all relevant steps in the European semester process. Here we have the country-specific recommendations on minimum income, for instance, or integrated active inclusion, adequate social protection systems, and so on. And finally, EAPN will never get tired to demand and propose for an EU framework directive on minimum income. This brings me to the last point: proposals to support the rights of people with disability facing poverty. Continue working for including specific actions in the European Disability Rights Agenda to address poverty and social exclusion, which put people with disabilities at the heart. Continue advocating on the guarantee of work-related rights of people with disability, also freedom from discrimination and access to services, and rights to adequate minimum income free from negative conditionality and punitive job readiness conditions. Also continue claiming the direct participation of people with disabilities, also in the designs of policies, giving voice for those who face poverty and are currently excluded from the decision-making processes. Then I mentioned it before, work together with us, ELPN or other NGOs, to make the case and gain political support for an EU framework directive on minimum income and minimum wage. Also work together with other NGOs on joint advocacy for an action plan for implementation of the European pillar of social rights, both nationally and at EU level, with a clear focus on the eradication of poverty and the reduction of social exclusion, including for people with disability, and comprising a new EU anti-poverty strategy and a Europe 2030 strategy as overarching framework. And also, I said before, engage in the European semester, in particular by influencing and monitoring in your country the national reform programs and the country-specific recommendations. And finally, I also want to give a few personal proposals out of my own situation as a person with disabilities living in Austria and out of the context of the Austrian welfare system. First, I would propose implement EU-wide income tax exemptions for people with disabilities. Second, define and enforce mandatory hiring quotas for people with disabilities. Also, adapt the so-called partial retirement arrangements to comply with the needs of people with disabilities. And finally, like a summary of all of what I've said, implement a poverty-proof levels of minimum income. This means an adequate, accessible, and enabling minimum scheme, which is EU-wide, and also fully involve people with disabilities as experts to find appropriate policy solutions. Thanks a lot for your attention.
Thank you very much, Vera, for this presentation. I'm going to hand over very swiftly to our next speaker. And Vera, one of the last things you mentioned was on employment, and this links very well to the next presentation by Stijn Broekhout from the Organization for Economic Cooperation and Development, who will be talking to us about the future employment prospects of persons with disabilities. So Stijn, I will hand over to you now.
Thank you very much, Haydn, for the introduction. Thank you also very much for inviting me. I find it very interesting so far. I'm not a disability expert. I'm a labor market expert at the OECD, so I focus on labor markets and the future of work in particular. I read your reports with very much interest. I think it was very sobering to highlight the challenges that many persons with disabilities face. And I think it's particularly worrying, as we've already discussed, as we are about to enter yet another economic crisis. So the perspective that I take is that work is key for escaping poverty. But what we also know is that the labor market works for some people and perhaps not so well for others. Haydn, you showed this very clearly in your presentation in the difference in employment rates between people with disabilities and people without disabilities. I think people with disabilities often have very poor labor market outcomes, and it's clear that we need to do something about this. We need to overcome the various barriers that these people face. This is an issue of fairness. I think we need to, it's only fair that everyone has equal access to the labor market, but it's also an issue of efficiency. And if we don't help people with disabilities into work, we are leaving talent behind. We are not using talent that is available to the economy. So there's a very clear social case for investing in persons with disabilities and getting them into the labor market. We have a choice between, on the one hand, paying benefits for people to stay out of work, or the alternative option, which is getting taxes from people who are working. So to me, the choice here is very clear. The problem is we are starting from a very challenging position. And there are also challenges going forward, not least the COVID-19 crisis, of which I will say a little bit more later on in what I have to say. But also more generally from what we were thinking about and working on even before this crisis, which is the future of work, as it is driven by several mega trends that we are aware of. So one of the issues is that many jobs, many tasks that people do are being automated. These are particularly low-skilled routine types of tasks. We have estimated at the OECD that around 14% of jobs are at high risk of automation, and another third involve or are jobs which face significant change. So the jobs might not disappear, but the tasks that people do will probably change significantly as we go forward. One thing we don't know, I think, is whether or not persons with disabilities will be more or less at risk from automation. I think this would be an interesting thing to look at research-wise. Going with this automation, we also see the labor market polarizing. So we have these skills, these middle-skilled jobs in the middle, not growing as fast as high-skilled jobs, which is on the one hand good news, but also low-skilled jobs, which are growing faster. We see this polarization also geographically. We have a kind of super cities emerging where people have seen very fast gains in living conditions and wages and employment opportunities, and we have rural areas falling behind. And it'd be interesting also to see to what extent there's a geography of disability and how that matches to this polarization that we've been seeing. And another big trend I think that we're seeing is the emergence of the platform economy, which currently remains quite small, but it has been growing very fast. Now, this presents lots of opportunities to overcome certain employment barriers, including for people with disabilities. But there are also very clear concerns around job quality. And when we talk about the platform economy, I think we're really talking about the tip of the iceberg. In many countries, though not all, we've also seen rises in other forms of non-standard work, whether they be temporary contracts or forms of self-employment or zero-hour contracts. And all of these forms of employment often come with health warnings as to the quality of the jobs. Now, I think there are many, many opportunities ahead, but also clear challenges. I think when it comes to persons with disabilities, I think this is a story we don't fully understand yet. I don't think there has been enough research yet in terms of how the future of work will impact this particular group. But also, it's not just one group, as I've just said. It's actually more. It is a lot of heterogeneity in disability, and there might be some groups that benefit in the future, whereas others fall further behind. And also, as people have already mentioned, there's the interactions with other sources of disadvantage in the labor market, such as minority ethnic groups or gender. Now, very briefly, how we see the future of work at the OECD is that, well, despite a crisis coming, if we think long term, we're not so worried about the overall number of jobs disappearing. I mean, of course, we have cyclical ups and downs in terms of employment, but if you look at the long-term trend, we are not so worried about massive, say, technological unemployment. So unemployment caused by automation. Technology destroys jobs, sure, but it also creates lots of new jobs. And we have seen over the last 20 years, employment rates have generally risen. Before the COVID-19 crisis hit, we saw many businesses facing scarcity in terms of recruitment, which is why they often reached out beyond, recruiting beyond their traditional pools of talent, which was in some ways good news for people with disabilities. Now the COVID-19 crisis might bring new challenges. Now, so if we keep our focus on the long term, we're not so worried about the overall number of jobs. What will happen, as I said, is that some jobs get destroyed, others are created, and one of the big challenges is managing these transitions. And transitions often come with huge costs involved for individuals and society. And the transition costs are not uniformly distributed across society. There are some people who will suffer more than others. And my hunch is that persons with disabilities will often face bigger transition costs than other people. So while the overall number of jobs is not the primary concern in the long run, what we do worry about is inclusiveness and leaving people behind as we transition to a new world of work. Now, this is where obviously policy is critical. If we see people having to move from one job to another, or having to adapt on the job to a new reality and take on new tasks, learn to use new technologies, skills is obviously a really important area to focus on. And yet we know that we are already doing very poorly in this in terms of participation in lifelong learning, and particularly the gaps that exist between high-skilled and low-skilled people in terms of participation in adult learning. And the other big area, of course,
sorry to interrupt you. I just we have 10 minutes left, so I was just ask if you have some concluding remarks, and so we can leave some time for some questions at the end. Sorry to interrupt.
That's fine. No, it's fine. I'm about to finish. And so the other big area that's important is social protection, and of course this comes out very clearly in this COVID crisis. Already before the crisis hit, we knew that 2 out of 3 job seekers in Europe, in OECD countries, did not receive unemployment benefits. So we can see the massive challenge that we have here in terms of helping in building a bridge when people lose their jobs. So just to summarize, and just a final comment, as we transition to this future world of work, I think we already start from a bad position. There are opportunities, but we really need to manage the transitions well, and we need to invest in skills programs and social protection. And while the COVID-19 crisis is very daunting, what it encourages me, as Elena already said, is the major steps that many countries are taking to make sure or try and limit the damage to the labor market and to people in jobs. So I will stop here. If there are questions later about COVID-19, I'd be happy to answer these.
Thank you very much. So we don't have much time left. What I'm going to do now is hand straight over to my colleague Loredana, and she is going to give us a bit of a personal testimony about how this subject has affected her. So I'll hand over to you now, Loredana.
Thank you very much, Haydn, and thank you very much for this opportunity. I will try to keep it short, but my name is Loredana, and I have come to Belgium in 2005 doing a volunteering project, and then in 2007 I decided to continue studying master degree here. And of course, when I decided to study, in order to be able to study as anyone else in the university and to be able to benefit of the services offered for students with disabilities, for the reasonable accommodation, services transcription in Braille, because I am a person with very, very low vision and I'm using Braille, I needed to pass through the disability assessment process. Now, I started my studies in 2007 autumn, and I have started also at the same moment the process of requesting the recognition of my disability in Belgium. And this one took quite long. At that moment, it was said that it will take place somewhere between 1 year and 18 months. So I entered my request in November 2007. The time to get all the documents they needed, it took that long. And then the time I got my response was in 2009 spring, and the first allowance on my account arrived in June 2009. So during my studies, I was living with 350 euro. 200 came from my disability benefits from my country. And I was lucky to receive a social scholarship that is to help students with social difficulties. So that was 150 euro. I was living in the house of a lady, so I was lucky that for the money I paid, the rent and a little bit extra, I received food. But I didn't have money to go to, with other students, colleagues, to go outside and live a student life. Didn't have money to purchase certain books that I needed. I don't say that the time that took to get my necessary equipment for my studies, I was about to have my first exam, so there I had quite difficulties. I passed only half of them, which was never the case when I studied in Romania, so it was not because of my level of knowledge that was lacking, but it was the means that I lacked as person with disabilities in that moment. At a point, the winter came, I didn't have clothes, and I was put in the unpleasant situation to go and requesting the help of my parish I was going to, and I could get some clothes from them, and yeah, I had to live in quite an undignified situation. Then luckily the good afterwards, almost after 2 years of my studies, I managed to get the benefits, and I would like to say that happy end was there, but of course life continues, and when I got married in 2010, immediately we received a message from the federal level that my disability allowance is reduced to 99 euro. Because my husband has income. My husband is also a person with disabilities, and yeah, he just have to foresee to my costs. And I was not yet working because I was just about to finish my studies. And this situation was solved only when I got again proper employment. It was luckily 1 year later. My disability allowance didn't increase, of course. It was just 1.5 years ago that I can say it increased again. So I'm receiving, let's say, now enough to cover my costs, but how long is it going to be the case? Because this is linked again to income. And I would like to say that to have started with once upon a time, but unfortunately I'm not able to say, because this is still a precarious situation for many persons with disabilities until the moment there is going to be, as EDF president request, a disability guarantee where persons with disabilities are insured a minimum income, a minimum package of services that helps us to live on an equal basis with our citizen colleagues. Thank you very much.
Thank you very much, Loredana. In the publication by EDF, there are many more personal testimonies like this that underline the seriousness of the situation. We have very little time left. We received some questions. Some are addressed to me. I will respond to those, I think, by email to everyone later. While we still have our guests with us, there's a question for Elena Schubert. Elena, are you still there? I know you had some problems with your connection.
Yes, I'm listening. I'm listening whole time.
So we have a question which is about the significant flexibility for the member states to reorient their EU funds in light of COVID-19. Do you think that these measures, or do you know of any measures in place to ensure that these funds are not diverted away from actions for persons with disabilities that might have been foreseen? Are there any such mechanisms in place?
I would not now be able to name you concrete examples because I'm not in charge of the management of the European Structural Investment Fund programs. But of course, we have the regulation that still is valid, and the regulation is very clear about the fact that we need to, all actions need to be in line with the United Nations Convention on the Rights of Persons with Disabilities. So it's not possible to deviate from the convention.
Okay.
But if you have this very concrete question, it can be also directed to the Commission services, and we can also provide you with a reply in writing.
Perfect. That's
by
brilliant.
services in charge of this of the management of the programs.
Okay. We received also a question for Vera. Since we've run out of time, we had 4 questions, I believe, in total. What we will do is we will reply to them in writing, and we will send this out to all of the participants. So that was our webinar for today. I would like to again thank our sign language interpreters, Haydn and Lisa, our live captioner, and all of our speakers, so Elena, Vera, Stein, and Loredana. And of course, I would like to thank all of you for taking the time during what I know can be a very busy period, and for joining us. And I would again invite you all to have a look at the publication and take from it any learning that is useful for you. So thank you again to everyone, and I wish you all a very nice day.
Thank you.